I did not put this agenda together, so I may ask Steve to verify what he meant by number 2 or confirm.
I put the agenda together.
Oh, okay.
So a couple of things. Do you want to? So one of the things I wasn't going to do talking today, but I will. Is this Kate? We have Corinne here to help facilitate this meeting, and she's new, so you just bear with it. In the future, she will fly solo, but I'm just here to give her some background through that. We want to hear from you. This is a client advocacy committee, and so I'm going to shut up. But what we did was there are 2 things that we're looking for gathering input on, and thing is, one is the geographic service area that currently is there for Benton area transit bus. The other one is getting some input that if we were to provide more service, what would it look like? So hours of service and also geographic area. That's what those 2 things mean.
Okay. So I'm sort of back up for a while because
Absolutely.
I've spent some time. I reviewed the public meeting, the STIF meeting, your last meeting, and it came to me that as a facilitator, number 1, I am to be neutral. Although my husband rode dial-a-bus when he was in memory care and in a wheelchair, and I take it through a different contract up to Salem with John to see the symphony because I can't drive at night. In terms of this project, I am neutral. My focus is helping you reach the objectives of the committee and to ensure that everybody feels safe to participate and that the process moves along. As I was looking at this, one of the things I said to give us some process, to give us some focus, is to clarify, starting at the end, is everybody clear on what the objective of this committee is? Do you understand your timeline? Do you understand the deliverables? Because it seems like we're starting with some very specific things, but yet there are some sort of overarching issues that you might want to clarify. The question is, does that make sense? That we make sure that you understand what your responsibilities are, what your task is, what your objective is, what you hope to come out of this. By when do you have to have it done? And then how are you going to do it? What are you going to do to get there? I've got some ideas on that too. I'm a pretty structured process person. So could we go back and say, what's your understanding of the objectives and the goals of your committee? Yes, Pam.
Okay. That working with the Benton County Commissioners and their concerns about their partnership with Dial-a-Bus, identifying those and working through those. And when the contract comes up in 2028, that my feeling is that a discussion where Dial-a-Bus can continue being the organization it's been, with maybe increased participation from volunteers and stuff like that, but a good partnership, and also increasing the service based upon our identifying what client needs are and having that set in stone. So when 2028 comes around, we all go and present our stuff and try to work with to get those goals met.
We'll need to do that before 2028,
Yeah,
however.
we need to do it.
Need to do it before the end of this year because the commission makes a decision in November.
Okay.
Right. Okay, so we have a timeline there. That's really important to understand that there are some very specific constraints that you have.
Okay.
And the report for commissioners goes out before that, doesn't it? It's like October that they're gonna, I think that was.
They'll probably get a report from the county commission that's going to meet September 15th. They'll get a report from that county group. It's a group in the county. Doesn't include us.
Now, who's that county group?
Well, it's gonna include both options, isn't it?
They're going to tell the commission what they think each option would be like.
Right. And what is this group?
Okay, that
Group
is your
for Dial-a-Bus.
question. Right. But what are the deliverables? What are you going to be presenting
We're supposed to present what the client's needs are and what our hopes are for enhanced services. I think
Yes,
that's the
what needs to
word
be
that was being used.
added or subtracted or changed in the service.
Okay, so the purpose of this committee is to communicate the specific needs of the clients of Dial-A-Bus.
Do you agree with that, Steve?
That was our intent when we put the committee together. I agree with Pam that there's a short term and long term. The short term is to have some, and this is, honestly, this really is better when it comes from the clients, not from me. But in the short term, it's to provide some very specific ideas on what we would like service enhancement to look like. Yes. And Ron kind of got to that really quickly in the last meeting when he said, well, the dispatchers can tell you what the busiest times of the days are. And that's really as specific and clear as that can get. And it's accurate too. And then the long term is, as Kate can tell you, written into every law and every statute that governs special transportation is the idea and the central tenet that clients should be the main drivers for policy in special transportation. And there was a client committee that existed in this county for a few decades that stopped meeting about 2 years ago. And client voices have been absent from this discussion for a very long time. And if you read the ORS and OARs and the information for this county, that client voice is required to be present. And so our hope, Dial-A-Bus's hope, the board's hope really was to reinstitute a steady conduit for that voice to be present in decision making. So that's the long-term part.
As a client, as I find out more, I find out more inequities in how it's delivered in the county. And a lot of that is due to federal regulations, but there's a great inequity between those that live in Corvallis and Philomath and those that live outside of those two areas.
Okay, that was another thing that came up to me as I was looking at this, is so you identify what the goals are, which is to serve as the voice of the clients, to identify those specific client needs, not only currently, but also in the future. And in terms of a way of looking at that, think of Dial-A-Bus as sort of a box, because you are boxed in. I mean, you're boxed in by the funding, by the statutes, by all kinds of other policies and regulations. And it seems like but we also have to think outside the box. And when Steve, last time, you were basically asking people to think outside the box, because these two things, the geographic and hours of service, are both things that currently you're not doing. But there are probably other things that are outside the box. So one of our focuses should be just sort of blue sky. What would an ideal position Dial-A-Bus system look like that you don't have now? Just get your wishes out. But then we go inside the box. We'll look at two different things. Number one, what's working? Sometimes when we forget about those things that you really respect and honor and treasure about Dial-A-Bus. You don't want to lose those. You want to make sure that they're documented and there's evidence and they're down there on paper so people understand. So you'll make sure that whatever happens in the future, those continue. And then thirdly, we look at what's not working. What are the inequities? What are the issues that some of them have come up already? You've talked about equipment, you've talked about scheduling, you've talked about a lot of things. But what's not working, and what are you going to do about it? So out of the box, what you want it to be, what's working, what's not working, and what specifically do you want to include in your report?
I'm gonna be the bad person here, but I think
Does that
that
make
there
sense?
has to be a distinction between Dial-A-Bus and Benton Area Transit. Those need to be separated. When you're saying you're working in this box, it's really, we're working in the box of Benton area transit.
Transit, right.
So that distinction really needs to be made evident.
Very good.
And, so when clients say they, ride Dial-A-Bus, they're riding with our drivers, but it is a Benton area transit service. So that needs to be made clear all the time. So
Very good.
I don't want to be the bad person, but
No,
it-
that's
it's
important because again, I'm new. So, and this is something also that perhaps clients may not understand totally also, that distinction.
right. Yeah,
I'm a little confused.
okay.
Okay, Benton area, I'm just trying to understand,
Yeah.
Benton area transit, and what I'm hearing, Dial-A-Bus is a part of it. Yeah, okay, but if I'm riding Dial-A-Bus or the back, okay,
So
name, but why isn't there a partnership? I mean,
there is.
okay, and what is that partnership?
I'll jump in.
Yeah.
So the county transportation program is Benton Area Transit. We call it BAT for short,
Okay,
right? So we contracted with Dial-A-Bus to provide the service because they have dispatchers and they have drivers that can do the service for us.
okay,
So Dial-A-Bus is a company outside of Benton Area Transit. They were in existence long before us. They'll be in existence long after us. We have a contract for them to provide the service for the county, and the service is Benton Area Transit, provided by Dial-A-Bus, the vendor we contract with. So it would be as if Pete, a handyman, you went out and you secured Pete's services to fix something in your house. You are the primary person providing funds to Pete to fix something in your house. So it's a contract that you have where you provide funds for services.
and it's an important contract.
It
Because
is,
the
yes.
need is there, and it's been established for years, and so it's an important partnership with that. Very important.
Right.
Because if you didn't have that, and there would be all this being the community, and no Pete's, provided. Yeah, so in other words, it's very valuable.
Yeah, I just think it's important that people know when they're asking for things, they're not actually asking from Dial-A-Bus, they're actually asking the enhanced service to be from Benton Area Transit. That's where
Okay.
I
Right.
want to make sure clients and people understand that.
And the
Yeah.
question is whether or not all of those services are parceled out or they are all kept in-house. That's the biggest discussion right now.
Right.
Christina has something to say on Zoom.
Sorry. I just wanted to emphasize if my understanding is correct, the very service that Dial-A-Bus is providing through Benton Area Transit is the same service that the nonprofit Dial-A-Bus was founded to establish in the Benton area county prior to it becoming a contractor for Benton Area Transit. Is that correct?
That is correct, Christina.
So I don't want us to lose the fact. It's not like we're talking about this is just a random contractor that happens to have dispatchers and drivers. This is a specific contractor that does have dispatchers and drivers, but those dispatchers and drivers and the nonprofit itself have decades of experience providing this to a very specific population of people, which is the disabled and elderly of the Corvallis and Benton Area County community.
That is correct.
However, it should be clear that when our contract is up, Dial-A-Bus's contract is up, there will be an RFP to continue, and other vendors will be open to bid that contract as well.
That has been the case. I've been here through 3 cycles of the RFP, and that's been the case every time. And I can't guarantee it'll be the case next time, but in the 14 years of those contracts existing. They're always 3-year contracts with the option to extend. So they tend to last either 4 to 5 years. No other vendor has put in for the contract. And again, that doesn't guarantee no one will in July of 2028, but that hasn't been the case thus far.
Well, if somebody does, they need to know what the clientele want from that vendor. So if they don't, the county commissioners will make a decision on, or whoever make a decision on which vendor to go with, but that vendor needs to know what they're signing up for. And so that will help them figure out whether they do want to submit an RFP or not, or a proposal or not. So, yeah. So anyway, what we're doing is important, whether somebody else decides to try to do this instead of Dial-A-Bus, but yeah, it's important to make sure that the needs of the clients are out there, clear.
A quick question. How long has Dial-A-Bus been providing the service to veterinary transit?
I'll give you 2 answers. So Dial-A-Bus started providing special transportation services in Benton County 52 years ago. The contract with, well, Benton Area Transit hasn't existed that long, but we started contracting with the county to provide the service when the city got a bus system. When they got a bus system, they were required to have an ADA component to that. And that's when the contractual relationship with Dial-A-Bus became the same structure that it is now. I think what you're remembering, Pam, is the relation in the time that you and your daughter have used Dial-A-Bus, the relationship has changed. It was much more of a partnership a long time ago, but it has, like, legally, it's kind of distilled down to a county and vendor relationship contractually, but the relationship was much broader and more intertwined prior to that, and I think you're remembering that. The STAC committee, the Special Transportation Advocacy Committee that existed for decades before it was disbanded about 3 or 4 years ago, was sort of the nexus of that relationship between the county, Dial-A-Bus, and clients. It met, the last iteration of it met right here in this room. And there were people from the community, there were people from DD Services who all came and got together and talked about what the budget should look like and what kind of service they wanted to, how they wanted to shape services. And I think that's the relationship that you're remembering, if that makes sense.
Why did that group break up?
It was, well, that was a county decision. The laws that governed public input changed when the STIF fund was signed into law. So the county was legally required to have a client and committee that gave client input, and that was the STAC committee. When the STIF funding was codified, they changed, so they wouldn't have 2 competing committees. Instead of having a STIF committee which decided how money was spent and a STAC committee that decided how service was going to be shaped, they gave counties the option to combine those into one committee, and that's what this county decided to do, was to just go with one STIF committee. What I think people have found, however, though, is that committee, its time is taken up, and both Kate and Kristen are on that committee and could speak better to this than I could. Their time is taken up by allocating funds, and they become very focused on that, and that's their main charge. And so the voices of clients have been quieted somewhat in the functioning of that committee because they're so focused on figuring out what the funding is going to look like and where it's going to go. Is that in the ballpark, Kate? Does that answer your question, Darryl?
Yes.
So let's go back to that question that's on the agenda.
Because this is, and if we have the box, and it's basically, is it better to call it sort of like disability services? Is that more general than just saying dial a bus?
Yeah, I mean, that's,
So that's
that's
still.
up to you guys, yeah,
Okay,
but I mean.
So we're still looking at what it is that could be enhanced, and these are the first two questions that have come up we want to address and find out what you feel about input on added services regarding geographic area. What are the concerns there?
I have some,
Right.
I have to ask to find things out, but I'm not bashful and I get answers when I ask. I'm told that the hours of operation for people that live in the city of Corvallis and Philomath start at 6 in the morning and end at 9 at night. So it's 15 hours worth. And for those people that live outside of the city limits of Corvallis and Philomath, and I'm not sure it's the city limits boundary, it may be ADA, but the ADA requirement is within 3/4 of a mile of a bus stop for both ends of the trip, plus the medical requirement. But basically, to me, that means in the city limits. It's not exactly that, but it's pretty darn close. And for those people that live outside of that area, the hours of operation are 8 to 6. So that's 10 hours. That's quite a disparity. And then besides that, it's still with limited rides. There are still people that get bumped. If they are not ADA, whether they live in the city limits or not. So some people in the city limits would get bumped if they're not ADA just as easily as those people who live outside the city limits. And that's up to the day before the ride. They don't bump the day of the ride, I was told, but they'll bump up to the day before the ride. The earliest you can schedule is basically a week out. And when
For non-ADA people within the city limits.
pardon me?
For non-ADA people within the city.
No, up to a
limits.
week for anybody,
Oh, that's for anybody?
Yeah, I was told it's for everybody.
Yes.
Okay.
except for, some of Dawn's people who are developmentally delayed going to work sites. That is under the Title 19 program, and those clients have set rides. So, and that's part of their contract that they have with the county.
And I was told that they bump on last scheduled is the first one to be bumped. So they have in the neighborhood of, and Carmen Roberta would know better, but they have in the neighborhood of 12 routes a day. It's not exactly 12 every day, I was told, but the days I've asked, it's been about 12, 11, 12, or 13. And so for each time slot, I'm not sure that those routes go all day long, but I think they go during the busiest times of the day, which would be morning and late afternoon. And I think the morning for those rides goes up till noon, actually, from 8 to 12 is a really busy time, trying to get rides. And so there's no distinction between in the county or outside the city limits or inside, excepting for the ADA thing. And I'm told that's a result of the federal regulations. There's not a direct rule that says ADA gets to do that, but as a result of other federal regulations, that's what they have to do. And so I feel like there's an inequity. If you live outside the city limits, you get 10 hours of service instead of 15. And then because Saturday there's only one route, if ADA people want rides on Saturday, they get them and nobody else does. And Sunday is ADA only. So that means only people in the city limits of Corvallis and Philomath. That's another inequity. And the county says that one of the things they want is equity. And from my point of view, equity does not exist.
Do you have data as to the number of people who are not able to get rides because they can't get them scheduled first or who are bumped?
I don't have that data.
Is there
Maybe they
data
keep it in the office. I don't know. I haven't asked about that.
That would be very good to have is.
So, some, we do have some data, but we also, we question whether some of that is the complete data because people over time maybe quit trying to schedule on a
exactly.
Saturday. And so then I wouldn't have any way of digging up a
Right.
number.
That is correct. I can
So-
verify that there's at least one person that quit trying to get rides on Saturday.
And
Yes.
we found that we call that latent demand. It's the demand that's out there that we don't know about. And we actually know that to be very significant.
Yeah,
I mean, the dispatchers get to know names and voices and, you know, they're very aware of lots of folks outside the county.
A quick question.
Okay.
First of all, is someone actually paying attention to those of us on Zoom when we raise our hands?
Yes, I can see it. I was just waiting for them to finish what they were saying.
The problem with that is just that the conversation can start to go on long enough that it deviates from why I actually raised my hand. So that's why I ended up interrupting. The other question was on the hours of operation, the 8 a.m. to 6 p.m. Is the 6 p.m. Cutoff in terms of the pickup time or the drop-off time?
Pickup time.
Okay, thank you.
Does anybody else have a comment about this concept, about what Ron's brought up and the hours of operation and the perceived inequity between city and
it's
county?
my understanding that the inequity is because the city of Corvallis is required to provide services, ADA services within their bus route area. And the county does not have a similar source of funding to make that happen.
It's both things. They're not required by law to make that happen.
Okay,
The county commissioners in this county at least have always tried hard and wanted to provide that service. But then that's when the funding realities kick in and we get to the number of 12 routes that we've landed on that we can currently pay for. But as I was saying, the latent demand is really hard to measure. We just know it's out there and that it's pretty big. Dial-A-Bus ran a pilot program about a year ago now where we added routes at our own expense. And we added 3 routes a day.
Yes,
We added
it was 2.
We had 2 routes a day, which is, that's a significant increase. That's like a 15% increase, and those filled immediately.
More than that, it's a 16% increase, almost 17.
Thank you, math teacher.
Well, you said almost 15, it's actually over 15. That's why I said that.
Yes, those routes filled, and that was in absence of us even publicizing that they existed. We didn't let anyone. We just put them on the sheets, and then they were full. So we know that demand.
I've talked to people, I can't remember who it was right now, but over the 4 years that I've been writing, I've talked to people, tell them I write it, how much I like it, what it means to me, how much it improves my life. And I've had people say, either they or someone they knew quit trying to get rides because they couldn't. I was persistent and I found out the earliest I could call, and that's how I get rides. And I have a reminder on my Alexa for me to call. I don't make that reminder every day, but I have it there. And it makes a difference. That's how you get rides. That's an inequity for people that aren't as persistent or as forceful, or whatever the right word is, as I am to try to get rides.
I can also vouch for not calling in about rides on the weekend anymore. I've stopped calling in because I feel like there isn't enough coverage and that there are people who need it more than I do. So I put, getting exercise or groceries below someone who needs medical care. So I don't call.
Pam, did you have something you wanted to? Yeah, it's just a question. Okay, back in 2013, I broke my arm. Okay, and I required transporting friends helped me out, but I also needed help going in for physical therapy in Philomath. And I had the opportunity to meet everybody who came pick me out as a volunteer. They had their little shift that like Mondays I'm on from 8 to 12, you know, kind of thing. And they had an individual car. And so I talked to them and found out, well, how did you got involved with this? And they just said it was just such a wonderful opportunity of giving back kind of thing. And my question is that, is there been a decrease in volunteer people who have their little shifts through Dial-A-Bus?
So prior to the pandemic, we had probably about 25 to 30 active volunteers.
Okay.
The pandemic reduced volunteerism across the country.
Absolutely.
And we experienced that as well. We had armloads of volunteers sort of retire at the pandemic. Currently, we have 17 active volunteers. So it's the number of volunteers we have has grown significantly just in the past really six to 12 months.
Okay.
We signed up 3 new volunteers in the last 2 months. So volunteerism is back on the rise, at least for Dial-A-Bus. And Emma has done quite a bit of work to make sure that people know that opportunity exists. And this is another piece of information that needs to be disseminated much more fully, because what you experience, the positive nature of that relationship between volunteers and clients it's been, and I'm not being hyperbolic right now, it's been a community treasure for probably 50 years. Dial-A-Bus started as an all-volunteer organization. The entire board are all volunteers. And that relationship has been highly valued for a really long time. And honestly, in past RFP cycles, that volunteer group has been one of the main positives that the county saw as something that they really valued and really wanted to make sure was ensconced in the service. And so we kind of need to make sure that continues to be framed in the same light that you experience.
Because it's a win-win for everybody.
Yeah.
I totally agree. Totally agree. The volunteers add things in lots of ways. For one thing, they add rides without added personnel cost, except for the personnel cost required for administrative things. They're not paid drivers, so they don't add in that sense. So they add rides without being paid for doing so. And then they add that connection. They tell people about Dial-A-Bus, Benton Area Transit. And that's part of how the word spreads. And it's builds support for the program over the county, both for the riders and for the people that have driven for it. The drivers I've talked to say that their friends ask them about what's going on with what the county's doing. And, you know, some of them don't know, but I've been fairly involved in it and read about it and gone to some meetings. And so I tell them, and, you know, that's just, you know, they respond basically with, geez, if it's going to cost more money for the county to do it, why are they even thinking about it? But, you know, that's kind of what the process is going through.
Sarah, did you have something you wanted to add to that discussion about the
No.
hours or geographic? Daryl, how about you? You're
Yeah,
pretty quiet now.
I'm your Benton County outlier.
Okay.
So
let's
yes,
hear
I
from
get
you.
bumped a lot. I can't get my rides. I've just learned to tweak the system a little bit more to call in on Sundays for my Monday rides about a week. So I'm actually leaving the message a week plus in advance because they service those messages first thing in the morning.
That's a smart one.
When I first started Dial-A-Bus, as Steve said, and I think that was one of the huge strengths of Dial-A-Bus was the volunteer drivers and volunteer people. I got my rides all the time. And I would be going to 3 and 4 doctor appointments a day. And they would pick me up, take me to the next one, take me to the next one. If I was long in a doctor appointment, it was very flexible. The program was awesome. The Dial-A-Bus strengths, and I think that one of our points of our committee here, we really need to hit on is maintaining those strengths, that they're service oriented. I think that's super important, that Dial-A-Bus does an excellent job of service. I mean, They're friendly and respectful. When you get on the bus, they make you feel good. They don't put you down for walking into the door, not figuring out how to work the latch. Some of these buses are nuts. And apologetic when canceling a ride to your staff is excellent. You know, when they call me and say, Daryl, we need you to ride an hour earlier or an hour later, I'm fine. I'm just thrilled to get a ride without having to call somebody to come get me. So I think the staff, I think whatever program we choose, whatever program is chosen by this county, they have to stay with that program of service oriented. It's just super important that everybody's happy to get on the bus.
I agree with him. I've had doctor appointments go over, so I missed my ride. And, you know, the folks in the office, the dispatchers are good about juggling things so that you get a ride as soon as possible afterwards if you missed it because you were in the doctor's office for an extra 45 minutes. You know, the client, the rider, doesn't have any power over that. I mean, very few of us are going to walk out of a doctor's office because we've got a ride home. You know, if the appointment's still in progress, we want to know what the doctor thinks, what they find. You know, we want that appointment. That's the whole reason for the ride. And so the people, the dispatchers I found are very flexible. They, you know, they can work on the fly, take care of things like that. I agree with Daryl. They're service oriented. So we're the drivers.
So that's one of those good things. We definitely want to make sure that whatever happens in the future is continued. Is
Yes.
that relationship between the service providers and the clients.
Yes.
And Dawn, thank you.
And the providing of door-to-door service
Yes.
if necessary, not just for curb.
Okay, Dawn.
And you can, Carmen, you can probably help me out with this, but with DD and our contract is different. We also have issues with the outlying areas with getting folks, in for things. And we don't have the extended hours, like, so we end earlier, and some of our folks have stuff that's going on after that. So for us, it would be helpful. I mean, we don't have really complaints with folks in town and getting people to where they need to be, but it's the folks that are outside or they have later jobs or whatever, and they go later into the evening, or we need help with.
Yeah.
Different folks.
So your clientele, there's more, since COVID, there's more, clients working out in the community rather than at one or, I think we had like, 3 or 4 main work sites in town at pre-COVID. And then after COVID, there are more, companies, businesses taking on, her clientele as employees. And that means different hours. That means working at 8, getting off work at 8 o'clock at night. So, that means going to work earlier and stuff like that. So we build a route for her clientele, and then people change jobs or work different days, and now you're just trying to make them fit. So it's a Tetris game that you're trying to build all the time with more demand from Dawn's clients.
Is there a volunteer component to this program?
No, there's not.
Not at all.
No.
Has there ever been?
Very rarely. Those are usually the same drivers. I would venture to say the reason why is most of the clientele that Dawn has likes consistency. They're creatures of habit, and they really, really like, okay, this is my driver, Chris. He's gonna come pick me up on Tuesdays and Thursdays, and Beth's gonna pick me up on Wednesdays. And having that is really reassuring to them, and having that is very comforting. They know they're gonna go get on the bus and high five Chris. They know they're gonna get, so having that same, drivers is really, really important to the clientele that Dawn works with.
I
Yes.
wanted to ask Christine to chime in, because she talked last time we met, about, the difficulty with medical appointments being in, North Albany and Albany. And I'd like to hear her give that input just to round up around the geographic challenges that we're seeing. So Christine, could you let us know?
Think you mean Christina?
Yes.
Yeah. Yeah, so as I said, when I started writing with Dial-A-Bus was 2021, which obviously was in the midst of the pandemic. And at that, I think around 2022, I started needing to be seen at the wound care clinic, which is the Samaritan Wound Care Clinic in North Albany. And I had no issues getting rides over there. And then I started seeing, so there's Corvallis Sport and Spine. There's also Albany Sport and Spine, which is obviously part of the same physical therapy chain. They have the only physical therapist in the area who takes non-oncology patients for lymphedema. And so I started getting rides over to North Albany, specifically for lymphedema therapy. Then, I don't know, maybe it must have been around the time when I fractured my ankle. So I want to say like early 2025. It started becoming increasingly difficult to get those rides. It actually got to the point where I had a physical therapist here in Corvallis who transferred over to the North Albany office when I was doing my ankle rehab, and I wanted to follow her over to North Albany. And Eileen basically had to tell me, I just can't get you rides over there. And same thing happened when I lost my primary care physician here in Corvallis. The best physician that matched my needs was again in North Albany. And Eileen had to tell me, I'm sorry, Christina, I just can't get you over there. So there's been a definite change in how available those rides to North Albany are. And I think at least a couple of times we actually tried booking me rides knowing that I could get bumped, because despite the fact that I live in Corvallis, I'm an ADA client. Since you're booking to North Albany, I'm dealing with the same issue as Ron and the other out of town clients are, where you can get bumped from rides. And I basically got bumped at the last minute from, these crucial medical appointments. And so at that point, I pretty much gave up. Wherever I could, I gave up trying to book those appointments in North Albany and tried to switch those services to Corvallis. The issue with that, with my lymphedema care, is basically been that a therapist in North Albany is basically having to tell the physical therapist here in Corvallis how to do some of my care, because they don't have the same degree of training that she does. But that's kind of what we're stuck with, getting the ride situation right now.
Okay, could you help me summarize this? Because I think is there anybody else who has something that specifically relates to what Steve put on here in terms of geographic? We've heard a lot of inequities and issues in terms of scheduling and not being able to get places. So how can we think of summarizing this in one nice neat little package that we can use later on? And
I think it's, at this point, it's still trying to work with other stakeholders in the community to realize that when they make decisions about, particularly the medical providers, when they make decisions about moving services, the impact on people who don't have transportation to get there. North Albany is one. Getting many medical procedures are not only available at Albany General, and people have huge trouble getting there. So that's part of the geographic one. But she raised the reason I wanted Christina to talk about it. She is an ADA client, yet when she goes out of the city to North Albany, she gets bumped. And these medical appointments are really hard to get. So, do we have the resources, and what are the resources there to do that? So to me, it was a shock to me to listen to her last time we met, to hear about the trials and tribulations of what seems should be a fairly easy one. We do know that we have clients that live in Adair, Kings Valley, just outside the city, who, if the service was available, would want ADA rides. And that's the question is, how can we look at what we're doing and perhaps look at other ways? I think this is something to take back to the board, actually, figuring out other ways to provide services. But that was really, identifying what you heard from Ron, and then the hours of service. I hadn't realized the disparity in hours of service. This input is really, really helpful.
Carmen, was I right about the hours?
Yeah.
Okay.
Yep.
I have a question that doesn't specifically deal with the geographic disparity, but has to do with efficiency. That I'd like to work in at an appropriate time.
Do we have time to do that now, or do we need to, what is your time frame in terms of the meeting length? Because people have rides and commitments, and
I do have to back out, but
because it's 11 o'clock.
Thank you for coming, Dawn. That should really be up to the committee. We'll get people home for sure.
All right. In his email, he said 11-ish, so I'm good for going unless the people that can't keep going for a while.
I do want to hear about the Wednesdays to the meeting, so.
As long as Dial West is flexible in getting me home.
Yeah.
We'll get you home.
Me too.
Hey, this is Kristen. I have a hard stop at 11, so, but I can
Do you want
sign
to
off and you can
summarize?
continue.
Won't take long.
Okay. I'm sorry, I missed the first part of what you just said, Kate.
So, do you want to provide a short summary of yesterday's STIF meeting?
Sure. Yeah, because like you said, it won't take long. We met yesterday. We went over the various projects to be funded or potentially funded for the 27-29 period. And we'll be meeting again on September 10th to continue that discussion. And just emphasizing that it is a public meeting. So if anyone wants to come and see that sausage making, you can come and observe that process. Are there questions from anybody?
What specifically related to this situation we're working with right here?
Oh, okay. So Kate and I serve on the STIF committee, which is the State Transportation Improvement Fund Committee. So I was asked on the agenda to just give an overview of what happened yesterday at that meeting. For anyone that's not familiar with the STIF, that is a citizen advisory board. We give recommendations to the Board of Commissioners on how to allocate funds for various transportation projects. So the committee is in the process of reviewing proposed projects for the 27-29 biennium, and we're still working on that.
We asked the county, we asked the participants that were there, we have a list of the various projects that are going to do some consolidation of the city to consolidate, but also to set the priorities for discussion so that we can come back to the committee. We'll meet and discuss those on September the 10th.
And when you say the Board of Commissioners, you're talking about the Benton County Board of Commissioners?
Correct. They are the ones that put the final package together that goes toward the Oregon Department of Transportation.
Okay, does anybody have any other questions on this meeting? They're interesting committee to observe because they do post them afterwards.
Yeah.
You can also attend them.
You can see those committee meetings online. They're post the recordings at some point, so you can look those up after the fact. And then they also do give the location and Zoom link for participation at least a week in advance. But if you just Google Benton Area Transit STIF Committee, you can get that information off the county website. And if everybody's okay with it, I'm going to just log off. Unfortunately, I'm swamped with work stuff. So do y'all need me for the rest of the meeting?
Thank you.
Thank you, Kristen.
Okay, thank you very much.
You want to address John's issue in terms of efficiency now, or at least bring it up? You could
Sure.
define what it is you're
Yeah,
talking about.
it's a very simple question, and I'm not sure that the people who can answer the question are still here. At one, we were talking about scheduling meetings after doctor visits and things like that, where you're not really in charge of when you'll be ready for your return visit. There was at one time something we called the pool. And basically you didn't schedule rides back from doctor visits. When you were finished, you would call and they would put you in the pool. And you would get a ride when it was available. And it was pretty efficient. You'd have to wait sometimes as much as a half an hour, but my memory was it was usually pretty fast. We don't have that anymore, and I don't know why. And just wondered if there's some reason that we don't have it.
The answer that you're not gonna like is just the number of rides that end up grouping together, are just about impossible to pull off. And
What does that mean?
well, because you mentioned the 45-minute waits, and sometimes that got over that because all of a sudden everybody calls in at once to go home, and then the last person or the person that lives far away is going to wait a lot longer. And there's also kind of a limit to the number of rides we can provide. I mean, just get it done. And if we just started doing pool rides, then you could almost accept twice as many rides and trying to stuff that into the same amount of time, and it just doesn't work that way.
So let's say you
We used to
only,
be able, we were providing more service.
Yeah. let's say, for example, we had 60 clients call and wanted a pool ride home. So we booked those 60 clients. Well, that's 60 clients. We now have to figure out how to get them home when I'm still booking all these other rides. Does that make sense? So
Yeah.
you have a, let's say you have
All the other rides are already booked.
120 spots available to book in a day. And I fill most of them, but there's 60 of those clients that don't know when they're gonna be done at the doctor. Now I've got 60 people, have to figure out how to get them home and when to get them home. Well, I still already have that 120 writers
So-
writing.
So we don't have it because the need for it has increased so much that we can no longer meet the need. Is that?
Correct.
That's correct, John.
Correct.
Okay.
Yeah.
That was a question I had from before was, is there a history of ridership that says, in 2019, there were this many clients, this many drivers, this many cars? Has that decreased? Is there a report somewhere that shows what those rides were and what they are now?
Yes.
Okay. Because it seems to me like when I started, it was much easier to get rides, and it's getting harder and harder and harder.
The other dynamic that really feeds into the great demand and our stretch resources is that the number of ADA riders has increased very steeply in relationship to non-ADA riders. And since ADA riders can't be bumped, that causes greater the inequity that Ron has pointed out. It increases that inequity. So not only has the number of total riders increased and continues to increase, but the number of riders who are ADA
Within the city,
right, is increasing in relationship to the total number of riders, which just stretches everything even more.
Do you have that published somewhere?
Yeah, we've got a graph. I can email that graph to.
That would be
I think that would be good.
Yeah.
I think the number of demand for rides has gone up. I mean, as the population ages, there's more people choosing not to own cars. And things like that. And once they're age 65, they can start calling in and get approved for rides.
See, that's an issue. I think we
And
need
so, yeah, so once that population, I'm 63 right now, so a couple of years from now, I don't want to own a car. I don't want to, I don't want to pay insurance. They have the same rights as somebody who can't drive. So, I mean, those two people are now competing for that one ride. So you have to understand that, by choices of some people, they are choosing to use the Benton area transit by choices of their own, unlike people like Ron, not a choice of his own to have to, you know what I mean? So the need for him to have to use
Right.
versus the want of somebody else.
Yeah, but I would not, I would hesitate to judge people who choose to stop driving.
Oh, no, yeah, no, I'm
Because, I
just
mean,
saying,
there's lots of reasons for
Yeah,
that.
yeah, exactly. No,
might
I'm
not
just
be
saying
apparent.
that demand is part of why the demand for rides is going up.
Right,
But some of those people could also ride Corvallis transit system.
some could, yeah,
Yes.
yeah,
Not, they're out. They can't.
yeah, not in Benton County.
No.
Like, I'm a person that I don't drive anymore, I can't drive anymore, but
Right.
I can, when I can, I take the city transit because I live in Philomath, which is really hard to coordinate rides to a doctor's office because you
Right.
gotta make the connection in downtown Corvallis and you may or may not make that connection. So anyway, yeah.
I would also add back into that, John. Effectively, that's what happens now. If you've scheduled a return ride home and it turns out, hey, I'm ready 2 hours earlier, you call, dispatch tries to figure out how to get you home in a more timely fashion as possible. And we do that. Just don't call it a pool ride anymore.
And they're good at it too.
Yes.
And they get to know us. They know the requirements. I think it makes a difference. They learn. It's easy for them to figure out the rides that can go together. I mean, there's 2 or 3 people that I ride with pretty often. Actually, probably about 4 of them now that I ride with pretty often. And it's an effective way to do it. When the computer, they had a program that was doing it, and it would give me rides with people that were in opposite direction from my house. And just ridiculous. But the dispatchers don't do that because they know where people live, they know the routes. The computer was just doing it by time. I don't know how it was doing it, but it was not doing it in what I considered an effective way. The longest rides I had were with that program. I don't have hour-long rides anymore for what is a 15-minute trip. But I did with that program.
I just heard a positive you want to make sure it completes. You've got the dispatch, the flexibility, adaptability, and expertise of the existing program.
Yes.
Is something that is good and
Yes.
should definitely be continued.
Right. The 3 dispatchers that are in the office the most, I know all of them by voice, and they know me by voice because I call often for rides. And I leave messages. Steve could do some of us a favor and give us the keystrokes on the phone to bypass that message. I've heard it about 50,000 times. But I call to find out if I got the ride that I requested, and sometimes I call to request rides or call to find out about a ride if it's late, which happens occasionally but rarely. It's just dealing with them is comfortable and easy, and they're efficient in what they do, and they're also nice about it.
Yes. And I'd like to just second that because I've had the experience with my daughter, with myself twice. Everything Ron said, it's just absolutely incredible. And also too, the volunteers that have been involved, they're benefiting greatly from this opportunity. And if we can increase that, and they know us, and then the drivers know us, yeah. So just second, everything was just said.
All right, I'd like to give one more kudo.
Yeah.
To Roberto. Roberto has worked with me a little bit to make the graphics that he's very famous for accessible. So if you have the right equipment, like I do, for some reason, I can make these graphs and read them nicely. Don't have to read a Excel spreadsheet or anything like that. Cool. Thanks, Roberto.
Thank you.
One other mention on the efficiency part is there is a problem with dial-a-bus and doctor's appointments. I've said it before, but you know, when you're scheduling doctor appointments, now half the time we're scheduling 2 months out. So we blindly schedule appointments, blindly, but we blindly schedule our appointments and then we just hope we get a ride. And it'd be really nice if there was some way we could, you know, at least put a placeholder in for, I don't know how to do it, but that's a real problem.
Yeah.
Well, the answer to that, I think the long-term answer to that is to increase the supply of service, right?
Right.
If it wasn't so competitive to get rides, that wouldn't be such a shot in the dark when you're scheduling a doctor's appointment.
So this goes back to early ADA in 1991, when the feds were trying to put together the regulations for the Americans with Disabilities Act. And the discussion over trip priorities. So early days, medical appointments were the top. They took that out from inequity. So you can't prioritize it. They legally cannot give you a priority for a doctor's appointment over somebody going to Winco, which is frustrating as all get out. And it's just, this is a legal requirement. They can't change that. But perhaps we could try a subscription thing.
You can't be over a certain amount on subscriptions. So you can't be over 50% on subscriptions. So if I have 3 spots available, I can't have more than, I can't take up more than 50% of that for people to call in.
So
To
for
book a
those
ride
who don't
or-
know, prescriptive rides are, so subscriptive rides are recurring rides. So if someone has a doctor's appointment every other Wednesday,
Okay.
every month,
And I never go over 50%.
when people have recurring needs or appointments, they can subscribe a ride. And yeah, and that means that that ride recurs every 2 weeks. They don't necessarily have to call to say that they're gonna take it. It just happens. And there's regulations that proscribe the number of subscribed rides that we can.
The subscribed rides have to be for medical appointments?
No.
No.
They can be for anything?
Yeah, yeah, they just, you're really limited in what you can do on that, so.
So the only thing you could do is write to your legislature to try to
Correct.
get changes made at the federal level, basically.
Yeah.
There's nothing you can do here
Yeah.
about prioritizing.
Right.
But there could be an unfairness issue
You have to keep
if I
your available.
were to try to get and got a subscription ride for some of the things that I do. I think that would be unfair.
Yeah, it's not,
That's your personal.
that system is not fair, Ron.
Yeah,
it's
part of
Well,
it-
what you're saying, Ron, is you don't think it would be fair for you to have a right to go up to Saddle
right.
Mountain over somebody who
That's
is
right.
going to chemo.
Right, I do that,
Yeah.
I do that on a regular basis, usually 4 mornings a week. And if that were a subscription ride, I think that would be unfair. Even though I do it and call in for it, I'm still competing for it every
Right.
time. I don't think it would be fair if I didn't have to compete for it.
So the other issue that's complicating this is, with the change in, I don't know if it's Samaritan or something, but some of the medical plans used to provide transportation. So you could go with a private, and those have gone away. So that's also increased the demand enormously here. So people who had other ways to get to a medical appointment through their medical insurance or whatever, right? That's no longer available. So that's why we're seeing it. And we have limited resources, but dialysis is a biggie, and figuring out ways to make sure that those people get to those appointments, but also employment. People need to get to work, and that's where a lot of places subscription services taken up with work trips, and dialysis, and that doesn't leave a lot of room for anything else.
No, but they should be able to get it if anybody does.
Yeah.
Correct.
And
I go to work twice a week, Mondays and Thursdays generally, 8 to 12 every time, but I'm flexible. So I call it, we work it out when they can get me there, when they can.
Yeah.
But if I have an appointment with NASA on Tuesday, I really need to be there. So,
All these problems would maybe not entirely go away, but would certainly diminish a great deal if we had reasonably adequate amount of service.
Funding.
That's the key to everything.
Yeah.
So on John's note, if I could just check in with the group to make sure I heard correctly, because we do have a meeting a week from today with the county administrator. What I believe I've heard in the last two meetings in terms of how this committee would like to advise the county commissioners of what greater service would look like. What I heard was to increase service during peak hours, which is the middle of the day on weekdays and all day Saturday, which we know to be probably the most competitive ride to get. And I heard address the geographical disparities and the amount of service available to people who live within ADA limits and those who live without. Is that a good summary? Do people have something to add or subtract from that?
Yeah.
Okay, thank you, folks.
Rotor rides over a broader area.
Got it.
So the other thing, I'm just looking at the time and that, do we want to table item 4 for a future meeting, or?
has anybody volunteered to come forth to serve as a chair and vice chair of this committee among the committee members? There's someone that you would recommend on the committee that you would feel good about contacting, reaching out and asking them if they would serve in that role? Everybody's quiet.
Ron seems to know what he's talking about.
Well, thank you, but I wouldn't want to be chair for a couple of reasons. One is I can't see, so it makes it really hard with agendas and seeing if people are doing something other. If they speak up, I can tell. And the other thing is, when you chair, generally you can't say what you think as much, and I don't want to be limited.
The difference between the facilitator and the chair. As a facilitator, I am neutral, but the chair can have opinions and does participate in the decision making.
Well, right now, we don't need a chair. You're running the meeting.
Well, are you
That's a
available
good point.
to continue facilitating? We have two people who have been contacted, Judith Kenner, who has a standing appointment on Tuesdays or Thursdays, and then I have a standing appointment, but I'm a little bit more flexible. I can sort of go in this afternoon and get my work done at the library. I'm helpful to come along if it's at all useful to have me here.
Yeah.
I think we would be better off with one facilitator instead of changing every time. I don't like that idea. I like the idea of one facilitator. Otherwise, at the beginning of each of the meetings with a new one, we go over the structure and all the stuff again. And I don't think we want to do that because I don't think we have time.
Okay, but maybe Judith could sometimes come and help because it helps to have people to observe because each person takes a little bit different perspective and can also watch what's going on around the room because that's a lot of people here. I will be back next time. When's your next meeting scheduled?
So that needs to be completely up to the committee and the facilitators' availability. That's certainly not going to be driven by dial-a-bus schedules. So
Let me give some information for Ron. We tried to find a facilitator, and what we found were two people who said no, they don't have time to be facilitators, but they could work together to be co-facilitators. So this is sort of the agreement that we have with these two people is that we won't ask one of them to do the whole job because it's more than they're willing to do. So that's the reason for having to.
If I might make a suggestion about the next meeting, I can put together an email and send it to the committee and the two facilitators and ask you all to give me some days of the week and times that work for everyone, and just choose the time that fits best for everyone. Does that work?
Last time we met on a Wednesday, didn't we?
I think so.
And I think we had more people in attendance that day than we have today.
Yes, for sure.
So Wednesday might be a better day than Thursday in terms of attendance.
Okay. And the folder,
If it would work for the facilitators.
It depends upon which Wednesday of the month.
Right, exactly. Yeah, not the third Wednesday. Other than that, any Wednesdays.
And one of the things I would ask you to think about for next meeting again is sort of the end product. What do you want to come up with? I mean, you always have to think about your deliverables. What are you going to deliver to whoever is going to be presenting this to the commissioners when they start getting together and making their decisions?
I think that may change as Steve has meetings with the county administrator and other folks from the county.
But as your clients,
Right.
you have a voice. You want to make sure your voice. And the other thing you might want to think about is it enough to have this committee's voice? Do you want to collect information from other users? And if so, how? Those are some things to think about.
Steve, have there been ways of collecting information from clients in the past? A survey or something that they could fill out?
yes. So we do it by phone, and we also just put written surveys in the vehicles, and we get lots of opinions quickly that way.
That seems very familiar.
Yeah.
I think it might be a good idea to do that again. Before a whole lot of time passes, but certainly before the county commissioners make their decision, and possibly before the September 15th meeting, the other engagement meeting.
That sounds great, and the only thing I'll need from this committee is and obviously we're not gonna parse this out today, but just what specific information and questions you wanna ask of the general clientele. I imagine it will reflect exactly something like what we're talking about in this meeting, but we should kind of drill that down so that we have some real specifics. And I guess the other question, Corinne, is how soon do we want the next meeting for this committee to be, so that I can schedule it more efficiently?
Do you want it to be before or after the next public meeting? Next public meeting is September 15th.
September 10th.
If you want to use,
Okay, the timeline, September 15th meeting, and then we're talking about, was it in November when the Board of Commissioners?
But that's when they get their report, but the people who are making putting together the report will be getting together way before that November meeting.
Right, so in other words, what we want to have together is the report for the commissioners. And do they get it like a couple of weeks ahead of the November meeting, or, I mean, how?
Probably at least, I don't know, Maya, do you have information on that,
What's our
when information will be provided to the commissioners so that they can start evaluating it for a vote in November?
I don't know if a November date has been scheduled for it, so I wouldn't have a clear idea of how far in advance they would get the information, since it hasn't been scheduled yet.
So
Would we know that at the September 15th meeting?
Maybe just shoot for having whatever documentation you would like by the end of October, so it's ready to go.
So there's a deadline.
As I understand it, they have, I don't know what the meeting's called, but the first and third Tuesdays are their regular meetings, and the second and sometimes the fourth Tuesdays are work sessions.
That's entirely possible. I,
Well, that's-
I don't pay attention to the work sessions.
That's what I was told. I don't, I believe that's the case. They don't always meet on the fourth Tuesday. If there's 5 Tuesdays, they don't meet on the 5th Tuesday. But I went to a 4th Tuesday and I was told they weren't meeting, and sometimes they don't meet on the 4th Tuesday. And I learned that the 1st and 3rd Tuesdays are their meetings, general commission meetings, and the 2nd and sometimes the 4th are work sessions. So we would want to have it ready by the 1st Tuesday in November to be sure.
So the next meeting of this committee should be in 2
When
weeks.
you meet with Rick,
The 7th or 27th, so a week from today.
the 27th, maybe we could meet like the 28th or 29th.
That seems soon. Do we want to meet the week after that?
That would work, but before the 15th meeting,
Yeah, I think we should.
but after you've met with Rick.
Okay. Well, I'll pick out a date and send it to the committee and the facilitators and see what works best for everyone.
Yeah.
Sounds good. Thank you, Ron.
Because then we know we've given as much input at this point to Rick.
Yes.
We've done that piece, that, okay. All right, so, okay. So before that. Okay. So,
May I ask, have you ridden with, spent a half a day or something riding with the dial bus driver?
With a dial-a-bus driver?
Yeah, on a dial bus, on one of their routes.
No, but I've written in area transit.
What would you like from this meeting?
What I want is inconsequential. I'm just here as an observer.
But you need information to make your decisions. Is there something you would like to know more from the clients?
I appreciate hearing people's experience and their compliments and their challenges. I think that's very insightful. However, I am not going to request any specific information. I am here as an observer, and this is mainly a client-focused meeting for you guys to have conversations with Dial-a-Bus, and I appreciate being invited.
okay. Any last parting thoughts?
How could this whole process be improved? Just any quick comments? Improvements. Make sure we get your opinions and feelings and thoughts and experiences.
I'll just make one comment. I came to the first meeting, and this one. What I've liked about this meeting, there seems to be more dialoguing going on and kind of identifying specific details. It's kind of like we're having, probably lack of a better word, a conversation about the issues. And so I think what you've done is kind of facilitated that. That's hopefully. Yeah, exactly. I felt that personally. So.
Well, I want to compliment all of you for your commitment to the process, for your being willing to speak up for the clients. It's courageous to do that. And you're obviously knowledgeable, and I really appreciate your experiences. So hopefully we can build on that and come up with something that does truly represent the needs and wishes of the clients. Okay.
Thank you, Corinne.
Thank you.
Thank you so much.